Hello, everyone, and a very warm welcome to you all. I hope you've been able to settle in somewhere comfortable, perhaps with a cup of tea or a coffee, and are ready to spend the next little while with us. So my name is Beck Minahan, and I work with Catholic Healthcare's Home and Communities team. I have the pleasure of coordinating our monthly webinar series, and I'll be your host for today's session. Whether you're joining us because you're living with a long-term health condition yourself, you're supporting a loved one, or you're simply interested in learning more about staying healthy and independent as we age, we're so pleased you've chosen to spend this time with us. So thank you for being here. Our hope is that today's webinar leaves you with a few practical ideas, a little extra confidence, and perhaps one new strategy that helps make everyday life just that little bit easier. As always, if you have a question at any stage, please pop it in the Q&A box or the chat box. There are no silly questions, and the chances are if you're wondering about something, someone else probably is too. And if we can't answer your questions during today's session, we'll make sure that we follow them up afterwards. We'll pause towards the end of today's webinar for a dedicated question and answer session where we'll answer any of those questions as they appear. So before we begin, I'd like to acknowledge the traditional custodians of the lands on which we all meet today. Although we're joining from many different communities across Australia, we come together today with a shared purpose to learn, to connect, and to support one another. We pay our respects to elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples joining us today. Thank you. So today's webinar is called Living Wisely with Long-Term Health Conditions, Tools for a Better Everyday. I really love that title because at its heart today isn't about focusing on one particular health condition, it's about living wisely. Many people live with long-term health conditions such as arthritis, diabetes, heart disease, osteoporosis, chronic lung disease, or persistent pain. And while every condition is different, they often bring similar everyday challenges, things like fatigue, pain, reduced mobility, or changes in confidence. Today, we're going to focus on practical strategies that can help across many different conditions. Because living well isn't only about managing symptoms, it's about continuing to do the things that bring purpose, enjoyment, and meaning to your life. Perhaps that's spending time in the garden, walking the dog, playing with your grandchildren, meeting friends for coffee, or traveling, or simply feeling confident and independent in your own home. Those are the moments we're really trying to protect. And that's exactly what today's webinar is all about. To help guide today's discussion, we've organised the webinar around 5 simple everyday tools. Our first is Know Your Body. Understanding what's normal for you, recognising changes early and knowing when to seek advice can make a real difference. The next is Keep Moving. Movement looks different for everyone, but keeping active in a way that is safe and enjoyable helps us stay stronger, more confident, and more independent. We'll then look at making everyday life easier. Sometimes the smallest changes, whether that's using a different technique, a piece of equipment, or making a simple adjustment at home, can reduce pain, save energy, and make everyday tasks much easier. Our fourth tool is Stay Connected. Looking after our health isn't only about our bodies. Staying socially connected, enjoying meaningful activities, and continuing to learn new things all contribute to living well. And finally, we'll talk about building your support team. Because living well with a long-term health condition doesn't mean doing everything on your own. Knowing what support is available and reaching out early when things change can make a real difference. Throughout today's webinar, you'll hear practical advice from a range of our health professionals, each sharing simple ideas from their own area of expertise. Today, you'll be hearing from 5 members of our multidisciplinary team. Michelle, our registered nurse, will help us understand what long-term health conditions are, why recognising changes early is so important, and how understanding your own health can help you stay well. Ahmed, our physiotherapist, will show us why movement really is one of the most important and the best medicines for many long-term health conditions. excuse me, and how staying active safely can help us continue doing the things we enjoy. Julia, our occupational therapist, will share practical ideas to make everyday tasks easier, reduce fatigue, and help us stay independent around the home. James, our health and wellness program coordinator, will introduce our Mind and Move program and explain how important lifelong learning, social connection, and movement all play an important role in healthy aging. And finally, our care partner, Sarah, will bring everything together by talking about how the right support at the right time can help people continue living independently and confidently. So let's begin with our very first everyday tool, Know Your Body. To help us get started, it's my pleasure to introduce one of our wonderful registered nurses, Michelle. Welcome, Michelle.
Thanks so much, Beck. Hi, everyone. It's lovely to be here with you today. As Beck mentioned, I'm Michelle and I'm one of the registered nurses at Catholic Healthcare. One of the things I love most about being a nurse is helping people better understand their health, answer their questions, and feel more confident living with a long-term health condition. Although we can't always change a diagnosis itself, there is often so much we can do to influence how well we live with it. By understanding our health, recognising changes early, and working with the right healthcare professionals, we can often prevent small concerns from becoming much bigger challenges. Our first everyday tool is Know Your Body. Knowing your body might sound quite simple, but it's actually one of the most important things we can do when living with a long-term health condition. Nobody knows your body better than you do. You know what's normal for you. You know how much energy you usually have. You know how well you normally sleep. You know what everyday activities usually feel like. You know how your body responds on a good day. And you often notice when something just doesn't feel quite right. That's incredibly valuable because the better you understand what's normal for you, the easier it becomes to recognize when something has changed. As nurses, that's one of the things we love helping people with. We work alongside you to understand those changes, answer your questions, and help you stay as healthy, active, and independent as possible.
Thanks, Michelle. And we've used the term chronic condition and long-term health conditions quite a bit already today. Before we go any further, could you help explain exactly what those terms mean?
Of course. You might hear the terms chronic condition and long-term health condition used interchangeably, and they really mean the same thing. A chronic health condition is a condition that usually lasts for 6 months or longer and often requires ongoing care or management. Unlike a cold or a broken bone that generally heals over a short period of time, chronic conditions tend to stay with us for much longer. Some remain quite stable for many years, while others gradually change over time. Some of the more common long-term health conditions many older Australians live with include arthritis, heart disease, chronic obstructive pulmonary disease, often called COPD, osteoporosis, chronic kidney disease, chronic back problems, and some cancers. Many people also live with persistent pain alongside one or more of these conditions. In fact, it's very common to be managing more than one long-term health condition at the same time. As nurses, we regularly meet people who might be living with arthritis and diabetes, heart disease, and osteoporosis, or chronic kidney disease together with high blood pressure. All these conditions affect different parts of the body. Each one can make everyday life more challenging. Someone with arthritis might find it difficult to get dressed because of stiff or painful joints. Someone with heart disease may become more tired or breathless doing jobs around the house. Someone living with COPD might avoid walking as far because they're worried about becoming short of breath. And someone living with diabetes may find they're juggling medications, monitoring their blood glucose levels, and paying closer attention to things like foot care, nutrition, and staying active. Just last week was National Diabetes Week, and this year's theme, Living Out Loud, celebrated the message that diabetes doesn't define who someone is or what they can achieve. I think that's a wonderful message and one that extends well beyond diabetes. Whether you're living with diabetes or another long-term health condition, a diagnosis is only one part of your story. With the right knowledge, support, and healthy habits, many people continue living full, active, and meaningful lives for many years. Understanding your condition is one of the most powerful tools you have. The more you understand what's normal for you, the easier it becomes to recognise when something has changed. Respond early and make informed decisions about your health. And that's where nursing can make a real difference. One of the biggest parts of our role isn't simply caring for people when they're unwell, it's helping people understand their health, answer their questions, recognise changes early, and feel confident managing their condition. So we can work together to keep them as healthy and as independent as possible.
Michelle, you mentioned that recognizing changes early is such an important part of managing a long-term health condition. How do we know when something is simply part of living with that condition and when it's a change that's worth following up?
That's a good question, Beck. The first thing I'd say is don't compare yourself to someone else. Compare yourself to you. Every one of us is different. We all have different health conditions, different abilities, and different routines. Instead of asking, is this normal for someone my age? Try asking yourself, has something changed for me? Sometimes these changes are quite obvious, but more often they're much more subtle. They tend to happen gradually, which means it's easy to dismiss them or simply put them down to getting older. So what sorts of changes are we actually talking about? Perhaps you're becoming more breathless than usual. Everyday activities like walking to the letterbox, hanging out the washing, or climbing a few stairs can suddenly feel harder for you, much more than they used to. Maybe you've noticed a new pain or an existing pain that become more frequent or is starting to stop you doing the things you enjoy. You might be feeling more tired than normal. We all have days when we're a little low on energy. But if you're needing to rest much more than usual or finding everyday tasks increasingly exhausting, it's worth paying attention to. Sometimes the changes relate to your mobility or balance. Perhaps you're feeling less steady on your feet, or you're finding it harder to get out of a chair, or avoiding activities because you're worried about falling. Even a fall or a near miss, whether you were injured or not, is something we'd encourage you to mention. Falls can sometimes be an early sign that something else has changed with your health. There can also be changes that are a little less obvious. Perhaps your appetite isn't what it used to be, or you've been losing weight without trying. Maybe you're becoming more forgetful, feeling confused at times, or your family has noticed changes in your memory. Changes to your bladder or bowel habits, swelling in your legs or feet, or wounds that are slow to heal are all important things to bring to the attention of your GP or healthcare team. Now, I want to reassure everyone that not every one of these changes means something serious is wrong, but they are changes worth paying attention to. Because recognising a change early often gives us more opportunities to understand what's happening, put the right supports in place, and help you continue doing the things that matter most. One of the things I've learned over many years of nursing is that our bodies are actually very good communicators. They don't send us an email. They don't send us a text message. They often whisper before they shout. Those whispers might be becoming a little more puffed walking to the letterbox. Perhaps getting dressed in the morning leaves you feeling more tired than it used to. Maybe you've quietly stopped gardening because your knees have become more painful. Or perhaps you've noticed you're sleeping more during the day because you simply don't have the same energy you once did. Sometimes those whispers are gradual, that we don't even notice them ourselves. I remember visiting one lovely gentleman who said to me, "Michelle, I think this is just what getting older feels like." As we chatted, he mentioned he'd gradually stopped walking to the local shops. Then he stopped going to bowls. Then he started avoiding catching up with friends because he became breathless walking to the car. None of those changes happened overnight. They happened little by little. Because they'd happened so gradually, he didn't realise how much his world has become smaller. After seeing his GP, he was referred to the right health professionals, started an exercise program, and made a few practical changes at home. A few months later, he was climbing mountains. He wasn't climbing mountains, sorry, but he was back at bowls every Wednesday. And I think that's such a lovely example of why recognising changes early matters. It gives us the opportunity to step in while those changes are still small, so we can help people continue doing those things that bring them joy.
Michelle, one of the changes you've mentioned is pain, and our webinar also coincides with National Pain Week, which shines a light on the impact of persistent pain and how that can have, and the impact that can have on everyday life. We know many people living with long-term health conditions experience pain. What would you most like people to understand?
Look, Beck, one of the biggest messages I'd like everyone to remember is that persistent pain shouldn't simply be accepted as an inevitable part of getting older. While persistent pain is common for people living with arthritis, osteoporosis, chronic back problems, and many other long-term health conditions, it's also something we should talk about. This year's National Pain Week reminds us that persistent pain is real, it's common, and it deserves to be understood, not simply accepted. Pain can affect so much more than just one part of our body. It can influence how we move, how well we sleep, our energy levels, our confidence, our mood, and even whether we feel like catching up with friends or doing the things we enjoy. One of the important messages of National Pain Week is that managing persistent pain is about much more than medication alone. The best outcomes often come from taking a whole person approach, bringing together movement, practical strategies, education and support from a range of health professionals. If pain is new, becoming worse, lasting longer than expected, or starting to affect your everyday life, it's worth having that conversation with your GP or healthcare team. One of the questions I often encourage people to ask themselves isn't simply, does it hurt? It's, what is the pain stopping me from doing? Is it making it harder to get a good night's sleep? Has it stopped you going for your daily walk? Have you given up gardening because it's become too uncomfortable? Or are you avoiding seeing family and friends because getting out and about has become difficult? Those are all important changes, and they're things we'd really like to know about. As I mentioned earlier, one of the wonderful things about nursing is that we're not only here when someone becomes unwell. A big part of our role is helping people stay well. This means helping people understand their health, answering questions, providing education, supporting self-management, and recognising changes early so we can respond before they become bigger problems. You'll often hear the term self-management, and sometimes people think that means they're expected to manage everything on their own. But that's not what self-management means at all. Self-management simply means becoming an active partner in your own healthcare. It's about understanding your condition, recognizing what's normal for you, making healthy choices where you can, and knowing when it's time to ask for help. You're still supported by your GP, specialists, nurses, allied health professionals, care partner, and family. You're simply becoming part of that team. There are lots of simple things we can all do to help manage long-term health conditions and support our overall health. Attending regular appointments with your GP or healthcare team helps us keep track of your health and often allows us to pick up small changes before they become bigger concerns. Taking medications as prescribed is another important part of staying well. If you're ever unsure why you're taking a medication, you're experiencing side effects, or you're finding it difficult to manage multiple medications, please don't ever hesitate to ask questions. Your healthcare team is there to help you. Looking after your body through good nutrition, drinking enough water, keeping physically active, and getting enough sleep all work together to support your health. Keeping vaccinations up to date is another simple but important way to help protect yourself, particularly if you're living with conditions that affect your heart, lungs, immune system, or diabetes. And perhaps most importantly, keep talking. Tell your healthcare team when something changes. Tell us if you're worried. Tell us if something doesn't feel right, or even if you're simply unsure whether something is worth mentioning. We would much rather have a conversation early than discover months later that you've been quietly struggling on your own.
Michelle, before we move on, if there was just one thing you'd like everyone to remember from today's conversation, what would that be?
I'd like everyone to remember just one thing today. It's this. Be curious about your health. Notice changes, ask questions, and don't be afraid to seek advice early. Because the earlier we understand what's changing, the more opportunities we have to support your health and help you continue living well.
Thank you so much, Michelle. I appreciate your time today and sharing that information. Thank you.
Thank you.
Our next everyday tool is Keep Moving. To tell us why movement is one of the most important things we can do for almost every long-term health condition, I'd like to introduce our physiotherapist, Ahmed.
Thanks so much, Beck. I hope everyone can hear me okay. Hello, everyone. I'm really excited to be here today because movement is something I'm incredibly passionate about. One of the biggest misconceptions I hear is that having a long-term health condition means you should avoid movement. People often tell me, I'm worried I'll make it worse. I'm scared I'll overdo it. My knees hurt, so I think I should rest. I get too breathless to exercise. I'm frightened of falling. I'm worried I'll damage my back. If any of those thoughts sound familiar, please know you're certainly not alone. They're some of the most common concerns physios hear every day. When something hurts, our natural instinct is to protect it. But what I'd really like everyone to take away today is this. For most people living with a long-term health condition, movement is one of the best medicines we have. Not because movement cures arthritis, diabetes, or heart disease, but because it helps our bodies continue doing the things we want and need them to do every day. Whether you're living with one condition or several, staying active helps maintain strength, improve balance, keeps joints moving, support your heart and lungs, improves your mood, builds confidence, and helps you stay independent for longer. One of the things I often explain to clients is that our bodies are incredibly clever. They adapt to whatever we ask them to do. The more we move, the stronger our muscles become, our joints stay more flexible, our heart and lungs become more efficient, our balance improves, and everyday activities often begin to feel just that little bit easier. But the opposite is true as well. When we move less over a long period of time, our bodies adapt to that too. Our muscles gradually become weaker, our joints become stiffer, our balance starts to decline, we lose confidence, and everyday activities that once felt easy can slowly become much more difficult. That's why movement is so important for people living with long term health conditions. We're not exercising simply for the sake of exercising, we're exercising to make everyday life easier. As physiotherapists, that's really our goal. We're not trying to train people for a marathon. We're helping people build the strength, balance, and confidence they need to continue living independently and doing the things they enjoy.
Thanks, Ahmed. That was such a helpful explanation of why movement is so important. What types of movement or exercises do you most commonly recommend for people living with long-term health conditions?
So, one of the things I love about physiotherapy is that we don't always need complicated exercises to make a real difference. In fact, some of the most effective exercises are simply practicing the everyday movements that help us stay independent. We call these functional exercises because they help us function more easily in everyday life. Rather than exercising for the sake of exercising, we're strengthening the movements we use every single day. So we'll look at a few examples here. One of my favorite exercises is the sit to stand. It simply involves standing up from a sturdy chair and then slowly sitting back down again. Now, I know that doesn't sound very exciting, but think about how many times every day you stand up from the lounge, from the dining table, the toilet, from the edge of the bed. If that movement becomes difficult, everyday life becomes much more difficult too. That's why physios love this exercise. It strengthens the muscles in your thighs and hips, improves balance, and helps one of life's most important everyday movements feel a little bit easier. If you need to use your hands to help push yourself up, that's totally fine. The goal isn't to do it perfectly, the goal is simply to become a little stronger over time. For someone living with arthritis, stronger leg muscles can reduce the load through painful hips and knees, making standing up and sitting down more comfortable. For someone living with diabetes, exercises like this also help keep muscles active, supporting strength, mobility, and helping the body use blood sugar a bit more effectively as part of an overall healthy lifestyle. Another wonderful exercise are heel raises. Holding onto the kitchen bench or the back of a sturdy chair, simply rise up onto your toes before gently lowering your heels again. This strengthens the calf muscles, which play an important role in walking, climbing stairs, standing comfortably while preparing meals, and helping us regain our balance if we begin to wobble. For someone living with osteoporosis, heel raises are a simple weight-bearing exercise that helps maintain bone strength while also improving balance. For someone living with arthritis, stronger calf and ankle muscles improve stability and can make walking feel more comfortable and confident. Marching on the spot. This is another simple exercise that can make a real difference. It encourages us to lift our feet properly instead of shuffling, strengthens the muscles around our hips, and gently challenges our balance. That can make stepping over doorways, negotiating uneven footpaths, or walking through the community feel much safer and more confident. For someone living with heart disease, gentle aerobic exercises like marching on the spot or walking help improve cardiovascular fitness, making everyday activities feel easier over time. For someone living with COPD, it's also a wonderful way to gradually build endurance and confidence. You may still feel puffed, and that's okay. The goal isn't to avoid becoming breathless altogether, but to gradually improve what your body can do while taking rests whenever you need them. Wall push-ups are another favorite because they strengthen the upper body without placing too much strain on the joints. Standing facing a wall, you place your hands at shoulder height, slowly bend your elbows to bring your body towards the wall, then gently push yourself away again. It's a simple exercise, but strong upper body muscles make everyday activities like getting out of bed, pushing up from a chair, carrying shopping, opening heavy doors, and reaching overhead much easier. For someone living with chronic back pain, improving upper body and core strength can help support posture and reduce strain during everyday activities. For people recovering with or living with some cancers, gentle strengthening exercises, when recommended by the healthcare team, can also help rebuild strength and reduce muscle loss. Gentle stretches for our shoulders, chest, hips, and calves help reduce stiffness, improve movement, and make everyday activities like reaching into cupboards, putting on a jumper, or hanging out washing feel easier. Stretching is also a wonderful opportunity to slow down, focus on your breathing, and release some of the tension we often carry in our bodies. Many people tell me they feel stiff, more relaxed, and ready to get on with their day. Many people tell me they feel less stiff, more relaxed, and ready to get on with their day after just a few minutes of stretching.
Thank you, Ahmed. Those exercises are such great examples of how movement doesn't have to be complicated. But I know one concern many people have is whether it's actually safe to exercise. They might worry about falling, overdoing it, or making their condition worse. What advice would you give someone who's feeling a little nervous about getting started?
That's such an important question because it's something many people think about when they're living with a long-term health condition. The first thing I'd like to reassure everyone is that moving safely doesn't mean avoiding movement altogether. It means choosing activities that are appropriate for your current ability, listening to your body, and gradually building your confidence over time. One of the biggest mistakes people make is thinking they need to get back to doing everything they used to do straight away. In reality, our bodies respond much better to small and regular amounts of movement than occasional bursts of lots and lots of activity. I often remind people that confidence doesn't return overnight. It grows one successful movement at a time. Every time you stand up from a chair a little more easily, walk a little further than last week, or complete an activity you were worried about, you're teaching both your body and your mind that you can do it. And that's how confidence begins to grow. One of the easiest ways to build confidence is to make your environment work for you. If you're practicing balance exercises, stand near the kitchen bench or the back of a sturdy chair so you have something to hold on to if you need it. If you're walking, choose a flat, familiar path before tackling hills or uneven ground, and wear supportive footwear with good grip. And if you use a walking stick or walker, don't think of it as giving in. Think of it as giving yourself the confidence to keep you moving safely. The goal isn't to prove you don't need support. The goal is to keep moving. It's also important to remember that everyone has good days and not so good days. Living with a long-term health condition doesn't always mean making steady progress every week. Sometimes symptoms flare up. That doesn't mean you failed. And it certainly doesn't mean you need to stop moving altogether. A flare-up is often your body's way of saying, let's take things a little more gently today. On those days, you might shorten your walk, choose gentle stretching instead of strengthening, or simply reduce the intensity until your symptoms settle. The important thing is to keep moving in a way that feels safe and manageable, unless you've been advised otherwise by your healthcare team. If you're finding that flare-ups are becoming more frequent, lasting longer, or making it difficult to stay active, that's a good time to speak with your physio, GP, or healthcare team. We can help review what's happening and adjust your program so you can keep moving with confidence. Many people also become less active because they're worried about falling. Ironically, moving less can actually increase that risk of falling over time because our muscles become weaker and our balance gradually declines. Regular strength and balance exercises are one of the most effective ways to help reduce the risk of falls. Something as simple as practicing sit to stands, hill raises, or marching on the spot a few times each week can make a real difference to your stability and confidence. And if you've had a recent fall or a near miss, or you're noticing you're becoming less steady than you used to be, please don't just put it down to getting older. Talk to your GP or healthcare team. The earlier we know something has changed, the sooner we can help.
Thanks, Ahmed. Earlier, Michelle reminded us that persistent pain is about much more than medication alone, and movement is another really important piece of that puzzle. But I know this is where many people become unsure. If someone is living with persistent pain, how do they know whether it's safe to keep moving?
It's a question I hear regularly because many people living with persistent pain worry that movement might be doing more harm than good. Many people believe that if something hurts, they must be causing more damage. Sometimes that's true. Pain is our body's way of getting our attention, and we should never ignore pain that's sudden, severe, follows an injury, or is accompanied by symptoms such as chest pain, dizziness, or significant swelling. But when you're talking about persistent pain, pain that's been present for months or even years, the picture can be much more complex. One way I like to explain it is to think of pain as your body's alarm system. If we accidentally touch a hot stove, that alarm is incredibly important. It tells us to pull our hand away and protect us from getting burnt. Sometimes, though, when pain has been present for a long time, that alarm system can become more sensitive. It's a bit like a smoke alarm that starts going off every time you make toast. The alarm is real, the sound is real, but it doesn't always mean the house is on fire. Persistent pain can work in a very similar way. The pain you're feeling is absolutely real, but it doesn't always mean you're causing further damage every time you move. That's why we don't encourage people to ignore their pain, but we also don't want people to become frightened of every movement because they're worried they're making things worse. Instead, we encourage people to understand their pain, move in a way that feels safe for their body, and ask for advice if they're unsure. Another important thing to understand is that pain isn't influenced only by our muscles or joints. Poor sleep, stress, fatigue, anxiety, and even worrying about pain can all make our nervous system more sensitive and cause pain to feel worse. That's why managing persistent pain is rarely just about one thing. It's usually lots of small strategies working together. Regular movement, good sleep, taking medications as prescribed, managing stress, and working with your healthcare team. Each piece plays an important role.
That's a really helpful way of explaining it, Ahmed. Thank you. So how do we know the difference between pain that's okay to keep moving with and pain that's telling us to stop?
That's a great question. One of the questions I encourage people to ask themselves isn't simply, does it hurt? It's, what sort of pain are you feeling? That's where this traffic light can be really helpful. Remember, there's a general guide. If your doctor or healthcare team has given you specific advice about exercise or movement, always follow that advice. The green light is the sort of discomfort we often expect when we're becoming more active. You might notice your muscles working, feel a little stiff when you first get moving, or experience some mild soreness afterwards. Those are all fairly normal responses as your body adapts. The yellow light is your body's way of asking you to slow down and pay attention. Perhaps the pain is becoming more noticeable while you're moving. You're starting to limp or change the way you move, or your body's telling you you've done a little more than it was ready for today. Rather than stopping altogether, it may simply be a sign to reduce the intensity, take a short break, or modify the activity. The red light is different. Sudden or severe pain, sharp pain, chest pain, dizziness, significant swelling, or being unable to put weight on a leg. All are signs to stop the activity and seek medical advice. Learning the difference between those three zones can give people much more confidence to keep moving safely, rather than becoming worried by every ache or pain. The other reason movement is so important is because it helps break what's often called the pain cycle. When we're in pain, it's completely natural to move less because we don't want to make things worse. But when we move less, our muscles gradually become weaker. Our joints become stiffer. Everyday activities start to feel harder. And over time, our confidence can begin to drop. Before we know it, we're often experiencing even more pain than when we started. The good news is that gentle, regular movement can help interrupt that cycle. Not by pushing through severe pain, but by taking small, manageable steps that gradually rebuild strength, flexibility, and confidence. Every short walk, every sit to stand, every set of heel raises, they're all helping your body become stronger and more capable of doing the everyday things that matter to you.
Thank you so much, Ahmed. I think one of the most reassuring messages you've shared today is that movement doesn't have to be perfect to make a difference. It's about finding ways to move safely, consistently, and confidently in a way that works for your body. Thank you. Our next everyday tool is making everyday life easier. And to tell us more, I'd like to introduce Julia, one of our occupational therapists.
Thanks so much, Beck. Hello, everyone. I'm Julia. I'm an occupational therapist. And as occupational therapists, we spend a lot of time helping people continue doing the activities that are important to them. Sometimes people hear the word occupational therapy and think that we help people get back to work. Others think that we're mainly there to recommend equipment. Equipment is certainly a big part of what we do, but it's actually only a small part. Our real focus is about helping people continue living the life that's important to them. We look at everyday activities and find the ones that people are struggling with or find more difficult and ask one simple question: how can we make that easier? Not because we're there trying to stop people from doing things. It's really quite the opposite. We want to help people to keep doing as much as they possibly can for as long as they possibly can. And sometimes that's about building confidence. Sometimes that's about changing how we do a task or reducing unnecessary effort. And sometimes it's about introducing equipment or making a few simple changes around the home. One phrase that occupational therapists use a lot is work smarter, not harder. I need to do that sometimes or remind myself that sometimes. But living with a long-term health condition doesn't mean that you have to push through until you're completely exhausted. Often making a few small adjustments can reduce pain, save your energy, and help you stay independent for much longer.
I really like that phrase, work smarter, not harder. One thing we hear from many people living with long-term health conditions is that they often feel tired. Why does fatigue become such a big part of living with so many chronic conditions?
Yeah, so fatigue is something that we see across many different long-term health conditions. Whether someone is living with heart disease, diabetes, arthritis, kidney disease, or persistent pain, many people tell us exactly the same thing. I just don't have the energy that I used to. Sometimes people feel frustrated because they haven't done anything particularly strenuous, yet they feel completely exhausted. And it's important to know that fatigue isn't about feeling a bit tired. It's a very real symptom that many people experience, and it can affect almost every part of your daily life. Simple activities like having a shower, getting dressed, hanging out the washing, or shopping for groceries can suddenly require much more effort than they used to. And that's because your body is already using energy to manage the health condition before you've started the day. One of the ways that I like to explain this is imagine your energy is like money in the bank account. When you wake up each morning, you have a certain amount of energy to spend. Everything you do during the day uses some of that energy. Having a shower, preparing meals, cleaning the house, walking to the letterbox, going to appointments. If we spend all of our energy by lunchtime, there's often very little for the things that we actually enjoy doing. That's why occupational therapists spend so much time helping people use their energy wisely, because our goal isn't simply to help people get through the day. It's to help them still have enough energy left for the parts that really bring them happiness and joy.
That energy bank is such a helpful way of thinking about it, I think. So, what are some practical ways people can start making everyday life a little easier?
So, one of the biggest things that we teach is that it's okay to do things differently. Many people have spent their whole lives believing that a job isn't finished until it's completely done. So, they might vacuum the whole house, do all of the washing at once, spend hours in the garden, and then wonder why they're completely exhausted the next day. Or on the flip side, think I have to do everything because I'll feel exhausted the next day. Instead of asking, how can I get everything done? We encourage people to think differently and ask a different question. How can I make this easier for myself? There are 3 simple strategies that can make a real difference. So the first is planning. Rather than trying to fit everything into a busy day, try and spread larger jobs across the week where you can. If you've got a medical appointment in the morning, perhaps that's not the best day to also clean the house and do the grocery shopping. I've known people that are on regular weekly treatments or medications that can have a big impact on their energy levels or the way they feel at different times. But now they say, I know that I don't feel my best later in the week or in the afternoon. So I try to plan my week so that the things that need more energy are done at either the start of the week or in the morning when I have more energy and feel my best. And then I'm able to either rest or do the things that are more important to me when I need to. Planning ahead really helps you to use your energy more wisely. The second is prioritizing. Not everything has to happen today. Ask yourself what really matters. Sometimes leaving the vacuuming until tomorrow means that you still have enough energy to meet a friend for coffee or spend time with your grandchildren or enjoy one of the activities that you love and that is important to you. Because protecting your energy for the things that bring you joy is just as important as getting through your to-do list. What do you treasure in life? Ask yourself, what is important to you? And the third strategy is pacing. Pacing is about finding a balance between doing too much and doing too little. Perhaps think about, how can I break up this job into small, manageable tasks? Rather than cleaning the whole house in one go, maybe clean one room before taking a short break. Rather than gardening for 3 hours, spend 20 minutes outside, then stop and see how your body feels. I have a friend that experiences chronic pain, but they are a go-getter and they like to get things done. So they go out into their garden and do everything all in one go, but often suffer for it the next day, unfortunately, and aren't able to do what they'd like to. Pacing isn't about doing less. It's about using your energy more wisely so that you can keep doing the things that matter to you. People are often surprised by people are actually surprised to find they actually achieve more because they don't end up feeling completely exhausted when they do these things.
Thanks, Julia. And we've spoken a lot today about pain and movement, but pain can also make everyday activities much harder. How can occupational therapy help people reduce pain while still continuing to do the things that they need to and the things that they enjoy?
That's really an important question, because pain that affects everyday tasks can become very frustrating for people. Things like changing the bed, preparing dinner, unloading the dishwasher, carrying a basket of washing, or even opening a jar can become very uncomfortable and impact you in different ways. The good news is that we don't always need to stop doing these activities completely. Often simply we just need to change how we do them. One of the first things that occupational therapists look at is how your body moves during everyday tasks. Small adjustments to the way that you stand, sit, or lift can significantly reduce the strain on your joints and muscles. For example, when you're making the bed, walk around the bed instead of reaching right across it. This can place much less strain on your shoulders and your back. If you're unpacking the dishwasher, sitting on a low stool or placing items on the bench before you put them away can reduce repeated bending. When carrying a laundry basket or shopping bags, hold them close to your body, as this places less strain on your back and shoulders than carrying them with straight arms. And try putting them on a bench or a table when unloading them. And whenever possible, sliding heavier objects across the bench instead of lifting them can make the task much easier. These might seem like very small changes, but over the course of the day, they can significantly reduce pain and fatigue. Another principle we use is called joint protection. The idea is exactly what it sounds like: finding ways to reduce unnecessary stress on painful joints so they can continue working comfortably for longer. For someone living with arthritis, that might mean using the palms of your hands instead of gripping tightly with your fingers. Choosing lightweight cookware or using larger joints like your shoulders to open heavy doors rather than relying on your small finger joints. It's not about avoiding activity. It's about helping your body work more efficiently so that you can keep doing the things that matter most.
Those are such practical ideas. Thank you, Julia. And I imagine there are also lots of simple pieces of equipment that can make everyday life a little easier. Is that right?
Absolutely. Equipment is really about making everyday tasks work better for the person using them. I see it a bit differently though. The right piece of equipment can reduce pain, it can improve safety, conserve your energy, and make everyday tasks feel much easier for you. For example, a long-handled reacher can help picking up items from the floor or reach into cupboards without excessive bending or stretching. A sock aid or a long-handled shoe horn can make getting dressed much easier for someone with hip or knee pain. In the bathroom, a shower chair, grab rails, or a handheld shower head can make showering feel much safer and less tiring. In the kitchen, something as simple as a jar opener, lightweight cookware, or a kettle tipper or perching stool can reduce the effort needed to prepare meals. Keep in mind, none of these things are about taking away your independence. They're about making everyday activities safer, easier, and more comfortable so that people can continue doing them with confidence. So, equipment is only one part of the picture though. When you're living with a long-term health condition, the way your home is set up can have a big impact on how easy or how difficult everyday life feels. Occupational therapists look at the home environment and ask whether there's small changes that could reduce effort, improve safety, and help you continue doing everyday activities more comfortably and confidently. Sometimes that's improving the lighting in a hallway or a bathroom. Sometimes it's removing a loose rug or another trip hazard like cords or clutter across the walkways or lips at a doorway. It might be adding a grab rail where there's a little extra support would make moving around the house or home more safer. Or simply storing frequently used items between shoulder and waist height so that you're not constantly bending or reaching. These changes can reduce pain, conserve your energy, and make it easier to continue living independently at your home. Because when your home supports you rather than working against you, everyday life becomes much easier to manage.
Thank you so much, Julia. So we've spoken about understanding our health, keeping our bodies moving, and making everyday life a little easier. The next step is finding enjoyable ways to put those ideas into practice, whether that's through movement, spending time with others, or discovering a new interest. Finding activities we genuinely enjoy can make a real difference to our health and well-being. To tell us more about how we can bring all of these things together, I'd like to introduce James, who is our Health and Wellness Program Coordinator.
Thanks, Beck. Hi, everyone. So one of the things I love most about working in health and wellness is that we get to see people rediscover things that they, thought they lost. Sometimes that's confidence, sometimes it's strength, sometimes it's friendship, and sometimes it's just simply the joy of getting out of the house again. Living with a long-term health condition can certainly bring challenges, but having a long-term health condition doesn't mean life has to essentially stop. Doesn't mean giving up the things you enjoy, and it certainly doesn't mean you stop learning, growing, or connecting with others. That's really what our Mind and Move program, which I oversee, is all about. It's about helping people continue to live well. Our program is built around 3 simple ideas that research consistently tells us are important for our healthy aging. Those 3 things are movement, social connection, and lifelong learning. Those 3 pillars work together to support not only our physical health, but also our confidence, independence, and overall well-being. What I really love is that they're all connected. In most cases, one activity supports all 3 at the same time.
James, you've mentioned movement, social connection, and lifelong learning. Why are those 3 things such an important combination for people living with long-term health conditions?
Yeah, definitely. Well, we'll look at movement. So we heard from Ahmed, our physio, today just about how important movement is for people living with long-term health conditions. Movement helps us maintain our strength, balance, flexibility, and confidence. Helps us, getting out of a chair, walking to the shops, doing your gardening. The goal is simply to help people continue doing the everyday activities that matter the most to them. The wonderful thing about Mind and Move is that movement doesn't look the same for everyone. Some people enjoy gentle seated exercise, chair yoga, tai chi, because it helps, the balance and improve balance and body awareness. Some rather strength and balance classes, others prefer a walking group or dancing because it doesn't feel like the exercise at all. The important thing isn't finding the perfect set of exercise. It's finding something you enjoy enough to keep coming back every week. It's consistency, not perfection, that will make the biggest difference for you. But movement's only one part of the picture. As we mentioned, there's three, and the second would be your social connection. And I find this one personally incredibly important. One of the things we often see is that living with a long-term health condition can gradually make someone's world a little smaller. People, perhaps walking has become harder, but perhaps you no longer drive. Perhaps, you've lost a partner or a close friend, or maybe you've just simply lost a bit of confidence getting out and about. It rarely happens overnight, and often it happens little by little, day by day. And before long, people realize they're spending more time at home and less time doing things that they, once loved and enjoyed. Sometimes the greatest thing we can offer isn't another service, it's another person and someone to talk to. Someone who notices if you haven't been to a class for a few weeks, someone who shares a laugh over a tea and coffee after the class. Those friendships are incredibly powerful, and many people enjoy the class because they want to improve their strength and balance. But what actually brings them back is that they've found a community and a friend. Lastly, which is the third point, is our lifelong learning. Sometimes people hear that phrase and think it means going back to school, and it doesn't. Lifelong learning is simply about staying curious, try something new, keep our mind active, or learn a new skill. It's about challenging ourselves in ways that we actually enjoy. That might be, for example, joining an art class, learning Tai Chi for the first time, or joining a book club, attending an educational session, visiting somewhere you've never been before, or simply having conversations that make us think differently. Our brains love learning. Just as our muscles become stronger when we use them, our minds also benefit from being challenged in positive and enjoyable ways. One of my favorite things about these pillars is that they rarely happen on their own. For example, one of our Tai Chi classes, people often join because they just simply want to improve their balance. Cool, that's movement. While they're learning the sequences of movement, they're also challenging their brain and learning something that's completely new. That's lifelong learning. And at the same time, they're attending our class, chatting before and after, encouraging one another and catching up over coffee afterwards. That's our social connection. So I guess one activity brings together three powerful benefits. The same thing happens in so many of our programs. Someone might join an art class because they've always wanted to learn to paint. They leave having discovered a new hobby, meet new friends, and found a reason to get out of the house every Wednesday morning. And that's the beauty of bringing all these three pillars together. So one of the wonderful things I love about Mind and Move is something to suit a wide range of interests, abilities, and goals. If you're looking to become more active, we offer a range of movement programs, including gentle seated exercise, strength and balance classes, walking groups, and Tai Chi. Whether you're just getting started or wanting to maintain your mobility, these classes are designed to help people move safely, build confidence, and continue doing the everyday activities that matter most to them. Tai Chi is one of my favorites because it's a gentle form of movement. Focuses on slow, controlled movements that can help improve balance, coordination, and confidence, while also being incredibly relaxing. Many people tell us it's because it's become one of the highlights of their week attending our Tai Chi classes. For people who enjoy being creative or learning something new, we have art classes, book clubs, rhythm and beat music sessions, and a range of other lifelong learning activities. You certainly don't need to be an artist, you don't need to be a musician, and you don't need to be an avid reader. It's simply about trying something different, expressing yourself, keeping your mind active, and enjoying time with other people in a relaxed, welcoming, and supportive environment. We also have a variety of social outings, and these might include visiting local gardens, museums, cafes, or community events, giving people the opportunity to get out and about, explore new places, and enjoy good company along the way. What I really love is that the people often come for one activity and they discover so much more along the way. Someone might come for a Tai Chi class simply to improve their balance, then make friends and decide to come into our new art class together. Or someone who starts with a social outing might discover the confidence to try one of our exercise classes for the first time. And it's wonderful for me to see people exploring their new interests, building their friendships, and realizing they're capable of a lot more than what they thought they were. At the end of the day, it's not really about choosing the perfect activity. It's about finding something you genuinely enjoy and having something to look forward to each week. Because when we enjoy what we're doing, we're much more likely to keep coming back and keep doing it. And that's where we get a real benefit.
James, thank you so much. I think you've reminded us that looking after our health isn't just about what we need to do. It's also about finding things we enjoy, staying connected with others, and continuing to make the most of every day. Before we move on, if there was one message you'd like everyone to leave with today, what would that be?
If I'd like everyone to remember just one thing from everything I've said, it's this: don't wait until you feel fitter or stronger or more confident before trying something new. Often confidence will come because we take that first small step. Whether that's joining a local walking group or trying an art class, learning Tai Chi, joining an exercise class, meeting people for a social outing, or simply saying yes to something you haven't done before, every new experience helps us grow. Every conversation helps us feel more connected. Every class helps us build confidence, and every small step helps us continue living a healthier, more active, and fulfilling life.
Thank you so much, James. One of the wonderful things about supporting people living with a long-term health condition is that no one has to navigate that journey alone. It's often not one person or one service that makes the biggest difference. It's building the right support team around you, people working together to support your health, your independence, and the life you want to live. To help explain how those pieces fit together, I'd like to introduce one of our care partners, Sarah, who's going to share a simple way of thinking about building your own support team.
Thanks, Beck. Hello, everyone. Before I begin, I'd just like to acknowledge that everyone joining us today may be receiving a different support of level. Some of you may be support at home clients and already have a dedicated care partner. Others may be receiving services through the Commonwealth Home Support Program, where you may not have a dedicated care partner, and that's perfectly okay too. Wherever you are on that journey, today's message is really the same. As our health changes, it's important that our support changes with us. If you've noticed changes in your health or circumstances, don't keep struggling on your own. Reach out to one of the people supporting you, whether that's your care partner, your service provider, your GP, or simply My Aged Care. They can help you to explore what supports are available, connect you with the right services, and if your needs have changed over time, help make sure you're receiving the level of support that's right for you. At the end of the day, it's not about which program you're receiving, it's about making sure that you have the support at the right time so you can continue living the life that's important to you. As a care partner, one of the things I enjoy most about my role is getting to know the people I support. Every person is different, and one of the most important parts of my role is listening. Listening to what's important to you, what's going well, what's becoming a little more difficult, and what you'd like to continue doing. Because when we understand those things, we can work with you to build the right support around you as your needs change over time. One thing I'd really like everyone to know is that the support around you isn't something that's put into place once and then never changes. Life changes, our health changes, and sometimes our goals and priorities change too. What worked well 6 months ago might not be what's working right for you today, and that's completely okay. That's why it's so important to keep having these conversations with people supporting you, whether that's your care partner or your service provider. Perhaps you have started noticing you're becoming more tired than you used to be. Maybe pain is making everyday tasks more difficult. Perhaps you've had a fall, some recently come home from hospital, or you'd simply like to become more active and connected with others. These are exactly the kinds of conversations we'd love to have with you. You don't need to know exactly what service you need, and you certainly don't need to have all the answers. Our role is to listen, understand what's changed, and work with you to build the right support team around you. One of my favourite ways to think about that is through something we call your circle of support. At the centre of every circle of support is you, because you are always the most important person in your care. Once we understand what's important to you, we can begin building the right support team around you. One thing that's helpful to understand before we look at the circle is how it works. The supports closest to you are usually the people who are most involved in your day-to-day life, and often the people you rely on most. As you move further out, you will see other people and services that also play an important role in supporting your health, independence, and well-being. So this isn't just about who is in your circle, it's also about how well your support team works together and whether your circle has the right people around you for where you are in life.
That makes so much sense. And I know we're going to build this picture out now. So I'll get you to talk through a bit more of what that support team looks like, if you will, Sarah. Thank you.
Yeah, let's just take a moment to complete this picture. One of your circle of supports is your healthcare team. These are the people who help you understand and manage your health. This may include your GP, a nurse, a physiotherapist, or an occupational therapist, your pharmacist, or other health professionals, depending on your needs. As we've heard today, each person brings different knowledge and skills, but they're all working together towards the same goal, helping you stay as healthy, active, and independent as possible. The second part of the circle is your everyday supports. And these are the practical services that make everyday life that little bit easier. As our health changes, everyday tasks can sometimes become more difficult. Shopping may become tiring. Preparing meals may take much longer than it used to. Housework might leave you exhausted for the day, or getting to appointments might become more challenging if you're no longer driving. These supports are there to help take some of that pressure away. Depending on your needs, that might include help with personal care, domestic assistance, transport, meals, or equipment around the home. And this is where some people also have family helping out as well. The goal isn't to do everything for you, it is to help you continue doing the things that matter the most while conserving your energy and maintaining your independence. The final part of the circle of support is your people and community supports. Sometimes the greatest support isn't another appointment, it's the people, the relationships and activities that help us stay connected to the things we love and matter most. That might include family and friends, neighbours, community groups, your church, volunteers, or our programs like Mind and Move. As James shared earlier, staying connected is just as important as staying active. For some people, this part of their circle is already strong. For others, illness, pain, or changes in mobility can make it harder to stay connected over time. Building your support team isn't just about managing your health, it's also about making sure you have the opportunities to stay connected, continue doing the things you enjoy, and maintain a sense of purpose. One thing I'd really like everyone to know is that there isn't a perfect circle of support. Every person's circle looks different. Some people only need a few supports, others may need more support as their health changes over time. Neither is better than the other, and the important thing is to simply having the right supports around you for where you are in your life.
I really like that way of looking at it, Sarah. So where does a care partner fit in the circle of support?
That's a great question. I often think of a care partner as someone who helps connect the different parts of the circle together. We're not there to replace your GP or your family or any other people supporting you. Our role is to get to know you, understand what's important to you, and to help make sure your support team continues to grow and change as your needs change over time. For example, if pain is making everyday activities more difficult, we may connect you with an occupational therapist to support practical strategies or some equipment around the home. If you've become less steady on your feet or recently had a fall, we can organise physiotherapy to help improve strength, balance, and confidence. If fatigue has become more of a challenge and shopping, meal preparation, or housework are becoming difficult, we can review your services and arrange extra support so you can use your energy for the things that matter most. If you've been spending more time at home or feeling isolated, perhaps it's time to reconnect through a Mind and Move program or another community activity. And after a hospital stay or a new diagnosis, we can review your supports to make sure they continue to meet your changing needs.
You mentioned that our support team can grow and change as our needs change. Why is it so important not to wait until things become overwhelming before having those conversations?
Because small changes are often much easier to respond to than bigger ones. We often meet people who tell us, I wish I'd asked for help sooner. Perhaps you're becoming more tired. Maybe your pain is stopping you from doing things you enjoy. You've had a fall, or you're simply finding everyday life a little harder than it used to. Those are all good reasons to start a conversation, not because you're losing your independence, quite the opposite. Making small changes early often helps people stay independent, active, and connected for much longer.
Great. Thank you so much to our care partner, Sarah, and to all of our wonderful presenters today. I'm just mindful of time. We have gone over a little bit. So unfortunately, I think we might skip the question and answer component of today's webinar, but please feel free to send through some questions if you have any in this last few moments as we wrap up. And any questions that have been sent through already through the webinar or through the registration process, we will get back to those in the coming week with the follow-up email. So just to finish off, I wondered if each of our guest speakers would like to go through something that you would like everyone to most remember from today's talk. Michelle, do we still have you?
Yes.
Doesn't look... oh, good. Yeah. So Michelle, if there was one thing you'd like everyone to remember, what would that be?
Okay. Sorry, Beck, was this the living alone with?
This was just after the question and answer. I think it was around knowing your body and not to ignore changes.
Yes. So one thing I'd like everyone to remember is to know your body and don't ignore changes. Small changes can often be your body's way of telling you something isn't quite right. Recognising those changes early and seeking support can often prevent bigger problems and help you stay healthier for longer.
Wonderful. Thanks, Michelle. Ahmed, are you still with us there?
Yes, I'm here.
Fantastic.
For me, it's about keep moving. Movement doesn't have to be perfect or intense to make a difference. Every little bit of movement helps maintain strength, balance, confidence, and can even help reduce persistent pain. The important thing is simply to keep moving in a way that feels right for you.
Thank you, Ahmed. And Julia?
Yeah, my message would be to work smarter, not harder. Small changes to the way that you do everyday activities and the setup of your home can reduce pain and fatigue, conserve your energy, and help you to keep doing the things that you enjoy with greater ease and independence.
Lovely. James?
Yeah, mine would be to stay active, stay connected. Looking after our health isn't just about our exercise. Finding activities you enjoy, learning something new, and spending time with other people can have a really wonderful impact on both your physical and your overall well-being.
Wonderful. And lastly, Sarah?
And I'd simply say keep talking to us. If your needs, goals, or circumstances have changed, please let us know. The sooner we understand what's changed, the sooner we can work with you and make sure your supports continue to meet your needs and help you live the life that's important to you.
Lovely. Well, thank you. And thank you for those messages. They're wonderful reminders that while every person's journey is different, no one of us have to navigate this alone. I hope today's conversation has given you a few practical ideas, a little extra confidence, and perhaps more, most importantly, the reassurance that there are people ready to support you every step of the way. Before we finish, I'd like to also let you know that our webinar series continues throughout the year. You'll see our upcoming topics on the screen, along with the recordings of previous webinars that you can watch at any time. You can register for further webinars or access those recordings using the QR code on your screen. We'd also love to hear from you. So if you have any feedback about today's webinar, if there's a topic you'd like us to cover in the future, or perhaps there's a particular long-term condition you'd like us to explore in more detail, please let us know. You can simply reply to your webinar invitation email or contact Catholic Healthcare through our website or over the phone. Your feedback helps us continue creating webinars that are meaningful, practical, and relevant to you. If today's webinar has prompted any questions or you've noticed changes in your own health or circumstances, please don't hesitate to contact your care partner, your provider, your GP, or your healthcare team. They're there to help you access the right support at the right time. And finally, I'd like to sincerely thank all of our wonderful guest speakers for sharing their knowledge, their experience, and practical advice with us today. And thank you to everyone who joined us. We genuinely appreciate you spending part of your day with us, and we hope you found today's session informative, reassuring, and inspiring. We look forward to seeing you again at another webinar soon. So until then, goodbye for now, and take care, everyone. Thank you.